I was really inspired to go into hematology and oncology when I was a medical student and a resident. I happened to be on a ward that treated patients who had cancer, and I just found that the doctors who treated those patients I thought were the best doctors in the hospital. So I wanted to be like them, and I really liked the interaction that they had with their families and the patients, and I found it to be very rewarding, and so that's really kind of what started me on the road to this specialty. I don't have any kids of my own, but I call all my patients like all my children because I really, just really like interacting with children. And I just find that they are so much more, they rebound so much better than adults. And when you make them feel better, it's pretty obvious to everybody that you've made them feel better. My favorite story is that whenever you can't find a patient in the room, it's probably time for them to go home because they're in the playroom or doing something else. And that probably means they're feeling pretty good and you can send them home at that point. So that's kind of what I learned in residency. I think the best day for me is a patient who's come into the hospital who is very, very sick and in the bed and unable to do the things that kids like to do. And then, a week or two after starting chemotherapy, they've turned around, they're in the playroom, they're running after you, they come give you a hug. And I think that makes the best day for me.